Otex Ear Drops contain active substances urea, hydrogen peroxide, and glycerol. They are used to help soften and remove earwax, also known as cerumen, from the ear canal. Indications: Otex Ear Drops are indicated for the treatment of earwax buildup or blockage. They help to break down and dislodge excessive or hardened earwax, allowing it to be naturally expelled from the ear canal. How to use: Otex Ear Drops are meant for the topical use in the ear canal. Line your site with the affected ear facing upwards. Gently pull the earlobe upwards and backwards to straighten the ear canal. Using the dropper and still a few drops of Otex Ear Drops into the ear canal. Keep your head tilted for a few minutes to allow the drops to penetrate. After several minutes, or when you feel the bubbling and fizzing sensation subside, allow the drops to drain by tilting your head the opposite way or using a tissue to catch any liquid. Contraindications: Don't use Otex Ear Drops if you are allergic to urea, hydrogen peroxide, glycerol, or any of the ingredients in the drop. You have a perforated eardrum or ear infection. Precautions: Otex Ear Drops are intended for use in the ear only. Don't use them in the eyes, nose, or mouth. Don't insert any objects, including cotton swabs, into the ear canal, as this can push the earwax in or damage the eardrum. If you experience pain, discomfort, or irritation after using Otex Ear Drops, discontinue and consult a healthcare provider. Side effects: Common side effects of Otex Ear Drops may include, but are not limited to, temporary discomfort or mild irritation, hearing loss, usually temporary and due to the presence of liquid. Allergic reactions, rare. It's important to discontinue and seek medical attention if you experience severe pain, worsening symptoms, or any signs of an allergic reaction.